23 years ago, I started in the industry, and I had my very first call ever on a physician. Remember his name? It was Dr. Abrams. Called on him first because his name started with an A, and I worked alphabetically. Now, I'd just come out of my training, and I was pretty pumped. I had my story, I had my evidence, and so I went and I knocked on his door. His medical office was in the garage in front of his house. So I knocked on the door. I guess back then I got up a little earlier than I do now because it wasn't open yet. Got back in my car, started to drive away, but the front door of the house opens up. And an elderly woman's at the door. She calls me to the door, and I say, "I'm here to see Dr. Abrams. I work for Servier Canada." She says, "Come on in. Why don't you just grab a seat right here on the chair there? Would you like any coffee or toast or bagel with lox?" she asked me. And I thought, we didn't cover this in training. I wonder if this is the way it's supposed to go. I said, sure. I didn't want to annoy anybody at this time. "Harry will be right out. He's just down the hall. Take a seat over here." So I sit down. Now, Harry walks out down the hall in his bathrobe. I'm sitting somewhere down around where you are now. He takes a seat right here in front of me. Now, sorry for that graphic depiction, but he was in his robe at the time, and now I figure, okay, what am I supposed to do? Well, I launch into my product details, right? Because that's what I was trained to do. I hit all 4 of my product details. I hit every single key message. I walked out of there. I left him the samples. I got the signature. I entered it into my call notes, called my boss. I said, "I think that went perfectly." She said, "Maybe we won't call on Dr. Abrams anymore. We can take him off of the list." Now, one of the key learnings, one of the many key learnings on that first experience was, if you have a great story and you have all the wonderful messages and you have all the facts on your side, you got to make sure that you have the right audience listening to those things. I tell you that story because last year at this conference, there was a lot of really good presentations. And I think it was Ronnie who said this to me on the way out. He said, there was a lot of great presentations, but I wonder if we were not just preaching to the converted, and maybe we don't have our stories being told to the right audience. So at that time, I said, you know what, if I'm invited back to get a do-over on this, I'm going to make sure I have a presentation that is relevant to the audience that's there that day. So fast forward a few months from now, or a few months from then, I'm sitting down with Mitch having lunch, and he says, "Robin, how's your presentation for the Pharma Congress going?" I go, "I have a ton of ideas, but I'm having trouble bringing them all together into something cohesive for the audience." And he says, "Well, I just read a really good article in the paper about medical errors being the 3rd largest or leading cause of death in the United States." And I said, "Oh, yeah, that was probably the press release that came out on this study that was in the British Medical Journal. It was just published last week." He goes, "Yeah, wouldn't that be a great topic?" I said, "It was a great topic. I covered it last year." So I wanted to thank Mitch for not only the inspiration for what I'm going to talk about today, but also the title that he gave me, because then he came back, I guess he thought for a while, and he said, "Robin, I think a good title for your talk would be Groundhog Day." And I thought, you know what, that's exactly what I'm going to go with. Now, everybody here has seen the movie, I'm sure, or has heard about the movie. We know there's a movie, we also know there's a day. Groundhog Day is a day where we all go and see if the groundhog's going to have a shadow or not. For the first 75 groundhog days of the last century, the groundhog saw his shadow 5 times. By that point, you have a pretty good feeling that, you know what, February 2nd, it's going to be cloudy, but to this day, 35,000 people still show up to see Puxatawny Phil. So it's another learning there is don't let the evidence get in the way of a really great story. Learning number 2. So Groundhog Day, the movie, is Bill Murray gets a chance to live his life over every single day. He wakes up the next day. And for the first part of the movie, he just decides he's going to try and kill himself in a number of hilarious and innovative ways. The second part of the story, he decides, you know what, I have a chance. I'm going to work really hard to win over the girl. None of that's really working for him. Eventually, he decides, you know what, I've been given an opportunity to maybe do something that is not self-serving, that's good for the world. Hilarity ensues. He gets the girl. The world's a better place, and he gets to live his life. And so that's the lesson I want to take to you guys today. So when it was Groundhog Day, I thought, I'm going to look back, because this is the 10th year of this conference, and I'm going to look back 5 years ago to what I presented here. And this is what I presented: 5 tips for a better, smarter pharma industry. My title then, if you can tell, I was just at the beginning of my meteoric rise at Leo Pharma. And I presented 5 tips for a better, smarter pharma. And I thought, here's one of the things I presented to the audience at that time. I'm a big Far Side fan, and if you remember this cartoon, I won't go through it, but basically the guy's talking to the dog. He's giving him all these words, and all the dog hears is blah, 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 ginger, which is pretty much what our dogs hear, I'm sure, when we talk to them. And I said to the audience at that time, isn't that like the story that we're trying to tell about the value of innovation and the value of the medicines that we bring to this country? And I think all they're hearing is value, value, blah, 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 value, value. And I said, if we don't change the way we're approaching things, it's going to get to the way Gary Larson thought we talked to cats. All sorts of things with a cat, and the cat just basically walks away with the middle finger in the air. And I think that that's where we're at right now. We have this wonderful story, and you've heard about it today, yet nobody seems to be listening. And I think the other message here is, just because you have the story, just because you have the evidence, just because it's compelling to you, and just because you say it over and over again, sometimes the people that are listening to it just don't hear it. And so we need to put themselves in their shoes. And we heard again today, and we've heard it last year, about the industry doesn't give us access, our country doesn't have an orphan drug policy. We don't get access to innovative medicines. It takes layers and layers and layers of bureaucracy and resources before we can bring these wonderful medicines to patients. And I quoted Bill Murray back then from the movie Ghostbusters and say, this industry is in for a disaster of cataclysmic biblical proportions. We're talking about fires and volcanoes and earthquakes and rivers and oceans boiling over. We're talking about the dead rising from the grave. And then Bill Murray chimes in, he says, human sacrifice, cats and dogs living together, mass hysteria. And that's kind of where we're at right now. And I like this picture because if anybody recognizes the guy in the back, that's Harold Ramis. Harold Ramis is a Canadian. He directed and wrote Groundhog Day. Thank you very much. I'm done. All right, 7 minutes in and I haven't said anything worthwhile yet, so let's bring this home now. Medical errors are the third largest cause of death in the United States. We know that because they have data. What is the cause of death from medical errors in Canada? We don't know because we don't have the data. National Post presented this last year. Medical errors, there's a lot of lying, there's a lot of cover up. People in hospitals don't want to speak to this because they're afraid of sticking their neck out. 3 more articles, this one from the Globe and Mail this year, this June. Unfortunately, a baby died in this one because of an honest mistake made by somebody in the hospital. In this case, Sick Kids actually proactively pitched this story to the Globe and Mail to bring that out. But the parents didn't want to speak up about it because they thought this was just common. Toronto Star, this year again, another infant died because of a mistake made. These are all infants that have been dying from preventable medical error. Want another one? This one's just out of Vancouver, just a couple of weeks ago. A significant overdose of norepinephrine because they didn't set the pump right. So has it gotten better since the medical adverse event study was published in 2004? It has not. So we have a lot of work to do. So why am I saying this? I think that if we start to concentrate on this largest unmet medical need in our healthcare system right now, we might start to find the target audience that we're trying to tell our story to will start to listen. And so that's my message to you, but does it work? Well, I'll tell you, it does work. These are our patients. These are neonates who are born early with respiratory distress. They have a significantly high risk of dying. Many of them do, unfortunately. These are 2 babies that are in the NICU right now at Mount Sinai, twins born, 3 pounds and 1 pound. And those are the amount of hoses and things that are hooked up to these babies. They have a lot of complex things going on. The product that we make is inhaled nitric oxide. Back in 1998, it won the Nobel Prize for Molecule of the Year. In 1999 in the US, it won a prize from the National Organization of Rare Diseases for the best medicine. And to John's point, that was happening in the US in 1999. It still doesn't happen in Canada today. The product comes with the delivery device because if you don't give the product properly, the baby might not live. If you give too much of it, it's toxic and the baby will die. It's also for transport. Many of these babies are not born at Sick Kids Hospital or the Children's Hospital in BC, so they're born in remote communities, so we have to fly them or drive them in. So we modified our device and we modified our drugs so that you could bring the babies in on this product to keep them alive long enough before Sick Kids can get a hold of them. So what is my solution? Well, what we did is we managed to change. So when I took over this business, we were declining by double digits every single year. People wouldn't answer our calls. They wouldn't let us into the office. But we had a very compelling story to tell, as you can tell. But nobody would listen to us. So we changed the way that we went to market. So my suggestion to everybody in the office is to change the way we're telling our story, and not just tell the story with the data that we have, but let's do something about the biggest unmet medical need, which is preventable medical error. We have a database, we have pharmacovigilance people, we are talking about adverse events of our drugs and presenting that to Health Canada on a regular basis. Why don't we just get more transparent and start fixing this problem now? Because our healthcare system's unable to, and who better to do it than the healthcare leaders in this room? So I'm tasking everybody to try and do that. Why should you do it? Well, you can make some money, and I can tell you that we were 10% down 2 years in a row. We changed the way we approach this market. This year we grew our business by 30%. This product is more than 10 years old. Nobody wants to pay for it. At the same time, we changed our market strategy, and it worked. Integrity means doing the right thing. What could be more right than attacking preventable medical errors? And I know that every single one of you in the room has integrity on your values, because I checked. Ego. I'll appeal to the egos of the health leaders in this room. If you want a legacy left behind you, bringing medicines is one thing, but attacking this one unmet medical need might be something that people will remember. So thank you, everybody. I think hopefully I've given you something to think about, and ideally I'd love to try and maybe if we can lead this call to action on trying to meet this unmet medical need of medical errors, make it the 5th leading cause of death in Canada. That would be a pretty significant improvement. Thanks, everyone.